Hey, St. John's family, thanks for tuning in today and taking the time to break down hearing loss treatment or transaction. Really, what I'm hoping to accomplish is just to ask you what you want to see happen for you and your hearing health. And I'm going to start with a general health question, actually, and going to get you to think, I hope, a little bit. Okay, we'll change to the next slide. So I want to introduce myself, Robert Smith, the president and founder of St. John's Hearing Institute. And I want to share to preempt this, our mission is to reconnect you if you have a hearing loss. And our secret sauce, if you will, is simply that we listen to you. We take time, we use the world's best technology, and we actually do a very old fashioned thing here called rehabilitation. And that's so your outcome can be its best. And we're going to have a reminder on this next slide here that we would like you to mute your microphone so we can go to the next slide. Gonna wet my whistle here. I hope that's okay. So this will just create a better experience for all of us if you mute your mics until the very end. Okay, we'll go to the next slide. So here's the question I would ask you to ponder. When you look at your healthcare today, are you looking at it more as treatment, as in the past, or more as a transaction, the new way, if you will? And what are you looking for from your healthcare provider? And I guess this question next really hit me hard as I thought about it, and as I visit my own doctor circle, so to speak, is how long does your doctor spend with you now? And I just want you to ponder that for a second and count not the time you wait in the waiting room, or heaven's sakes, how long it takes to get an appointment now post COVID. That hurt. But how long do you actually get in the room with your healthcare provider to diagnose, discuss, and treat whatever it is you're going in there for? And the second part of that question is, are you okay with the time that your provider is spending with you? Are you getting enough? Are you getting too much? So now we're going to flip that over into the next slide, which is the Journal of American Medical Association Health Forum did a deep dive and found out about a year ago when they compiled results that the average healthcare provider is taking about 18, you might as well say 19 minutes with the patient, some less, some more. And I don't think there's many of us that are not familiar with the 12, or excuse me, the 15-minute model, where you typically get 15 minutes with a provider, 5 minutes where maybe you get to share what's going on with your health. And there's some diagnostic times your physician, your provider is thinking through what you're saying. And then maybe you get about 5 minutes on average, we're finding from the statistics that we have, for your healthcare provider to actually review their diagnoses as well as guide you on the next step or what they'd like to see happen for your health. I don't know about you, but we have to have some amazing doctors to actually make all that happen in a 15-minute visit, especially if it's a chronic or acute illness that you may have coming or going. So we're going to go to the next slide, and we're going to talk about your hearing health. So many times I've heard over the years that people look at hearing loss maybe as not a healthcare need, but as maybe a hearing aid need. And so we wrestle with that treatment or transaction question. And so many people say, well, I don't hear very well, or their family member usually brings it to their attention first and says, Mom, Dad, brother, sister, husband, wife, you don't hear very well. You need to go buy a hearing aid. And so that's all there is to it, right? And then I hear the drill down on that is, and they're all the same. These things just make everything louder, right? And so if I have a hearing loss, we automatically assume that hearing devices are the answer. And then we go shopping when we're ready. And I want to like unpack that a little bit. Okay, so we're going to go to the next slide. And visit that. And I threw this slide in because I wanted to just probe your mind and maybe introduce, maybe for the first time. This is a slide from Dr. Anu Sharma, PhD at the University of Colorado Boulder. And she does a lot of MRI studies of the brain with hearing loss, with and without treatment. And you'll see from the picture here that the MRI of the brain on the left with the hearing loss looks different than a normal hearing person's brain. And I just posted that up there. We're not going to dive deep on it. If you want to go deeper on it, you can go back to our website and you can go back to some earlier seminars where we dive a little bit deeper. And if you want, if you're interested, you could write down Anu Sharma, University of Colorado, at the bottom of the slide, because she is one of, in my opinion, by far, one of the greatest people to be discovering how much hearing loss is a cognitive function, not just a process of the ears. So we're going to go to the but well, I should say before we go to the next slide, it's okay, Carla, you can leave it there. So typically the mindset of a person is, all right, now let's go shopping for a hearing aid. Let's go out and get the best deal, right? And I've heard so many people say that same thing about their general health care with co-payments and as expensive as healthcare is, we obviously want to watch our dollars and cents. But at the same time, I'm hoping that you're going to have a great health outcome by taking care of yourself. So I made a little chart actually late last night because I was trying to think, how do I actually show folks out there, folks that are going to use this as their educational material and maybe even part of their healthcare journey. How do I show them the difference in what a transaction or treatment looks like and all the choices? And all of these are choices that are out there. They're not all the choices out there for hearing healthcare, but I think they present some stark contrast that I hope it's helpful to you. And they all could be good choices for the right application. So I'm going to start at the very far left. And Walmart, believe it or not, if you've seen the commercials on TV, they have a very compelling commercial. I don't watch much TV, but you could actually have hearing aids shipped to your home. You don't have to have any human interaction. You're obviously not going to get any contact or support with that. And you don't have to have a hearing test. I know that might not even make any sense right now, but it's the cheapest price. And you can get in for just a few $100s, you can get hearing aids that make things louder. And that's why we put the slide in prior, because we want to introduce you, if not before, that hearing and hearing loss is a cognitive function or a lack of cognitive function. And this is an option that may be the only option for some people because of dollars and cents or because of knowledge. But Walmart is definitely one of the cheapest places that you can buy a hearing aid, have it shipped to you, and have no human interaction and no help. So the next place started popping up over the last few years, Walgreens. There was an over-the-counter Hearing Aid Act bill passed a few years ago, and now you can buy hearing aids at Walmart. There's a little clear display. It's very neat. And you walk up to the prescription counter. And I know this sounds very anti-health, but it is an option for some people. You walk up and you see the choices of hearing aids. I want that one. You point through the little glass, and there's no testing necessary. You're going to get about 60 seconds worth of support by a very busy pharmacy tech. And you're obviously not going to get any one-on-one service or care, but you can call an 800 number and get your questions answered and some sort of service. And obviously, you're going to save thousands of dollars. So that is an option. And again, I want to introduce those. Those are more transactional types of healthcare. The next instance I have is Costco. Costco is a really good choice. We actually refer some people there, and you can go right to their warehouse if you're a member. And they do have actual licensed trained providers there. So this is a major step up in the transaction side. And they're going to give you about 30 minutes to test and recommend. And you may feel kind of rushed, but it's an actual trained licensed person who probably knows what they're doing and is a fairly good option. You're going to get follow up on demand when it's needed. You're going to call in, you're going to say, I'm having trouble. They'll set an appointment. You're going to go in and have that provider solve that issue that may come up. Now, it's a budgetary quality, so you're going to have a lower level of technology, but you're also going to pay the lowest price for, honestly, a pretty good deal. It's a lower level of technology, a lower price. So altogether, it's really a good value. Now, when people can't afford our rehabilitative services, and their economics are the main thing of whether they're going to get help or whether they're not. We actually have referred people to Costco, and because of finances, it's worked out for them. And now we're going to cross a line here. I just picked a retailer. There's a bunch of them: Beltone, Miracle Ear. There's several, Audibel. And these are all good places. You can go in the office, have a visit with a licensed trained provider. You're probably going to get somewhere between 60 to 90 minutes to have your diagnostics and get a demonstration and a recommendation after you. And by the way, welcome to those of you who are stacking up in line here that just joined us. Appreciate you showing up. And this, by the way, want to make an announcement. This will be recorded. It is being recorded. So we'll post it up on our website, and we'll actually send a link to it from your email addresses. But you go in a Beltone office or other good retailers, and you're going to get a substantial amount of time. You're going to get 1 to 4 visits after you get fit with hearing devices. Typically, you're going to get seen 1 to 4 times a year for follow-up care that you might need. And if you call in and you have an on-demand need, you're probably going to get seen in a reasonable amount of time. And their devices are usually made by another manufacturer, and they're relabeled as Beltone, and they're one of the top device qualities in the world. So one of the top 5 manufacturers. So overall, you've taken a major step in healthcare by getting something that's customized for your situation. So going to go one more column over to the right. You can go to an ear, nose, and throat doctor's office. Typically, they will employ hearing providers. If you see your ear, nose, and throat doctor, they examine you and determine that you have a permanent type of a hearing loss, that medical intervention is not appropriate. You're going to see one of their diagnostic providers, and they're typically going to spend 30 to 60 minutes with you in diagnostics and recommendation. And likewise, you're probably going to get 1 to 4 follow-up visits if you choose to use hearing devices. And you're going to get at least followed up on yearly and more if you call in and set those appointments. So it's a fantastic place. The doctor, matter of fact, doctor's office I love dearly here, Dr. Scott Green, best ear, nose, and throat doctor that I know of in the world. And we send all of our patients there for their medical needs. And they also are going to have access to the 5 top hearing device makers in the world. So that's a fantastic place. And as we go to ourselves naturally, I'd be lying if I didn't say or admit that we want to showcase who we are and what we do. And one of the things that I'm so proud of, I'm just going to go down the list, and you'll see that we're very old-fashioned. We actually come out to homes We go to, I would say, probably about 45 retirement communities in the Tampa Bay area. We'll also go to private homes. We specialize in seniors that are typically aging in place and they want a concierge rehab hearing program where they are. They can come to our office if they want to, but we have licensed trained providers. We're typically going to spend about 2.5 hours and diagnosing, discussing, demoing treatment, and making recommendations with you on a first initial whole visit. And sometimes it takes longer because our patients have questions. We try to set aside enough time where you feel super comfortable understanding what's going on and what your options are as far as treatment. Then once, if you choose to let us take care of your hearing, we'll start your treatment with the best technology in the world. It's called brain hearing technology. And we will then see you 4 to 12 times for rehabilitative services. And I'm often asked, what in the world is hearing rehabilitation? Well, it's the thing that we all study back wherever we get our academic training that we're all supposed to do, but because of time constraints and the way the medical model is going, quite frankly, it's let's see more patients faster and let's spend less time with each one. And I don't agree with that, but obviously it's where our medical system has been heading for some time, usually dictated by insurance. So we're actually going to take our patients through a rehabilitation process because the new information that comes to the brain through the custom hearing treatment takes time, just as if you would get a hip surgery. You're going to see a physical therapist to reacclimate your muscle groups and this new component for adaptation in your body. We're going to go through that same process with your hearing and the brain connection. And when we feel that you're up to your targeted rehabilitative level, we're actually seeing most of our patients monthly for their maintenance and just to make sure that they are hearing well and strong and that they're not losing benefit, whether that's in person. Most of our visits are in person, some televisits, but majority in person. And so after the 12 yearly visits, we're typically going to see you once a year to retest, to represcribe. And we're also going to manage your earwax because earwax is the enemy of hearing devices. Some of you probably know that already. And then if you have on-demand needs, our patient care coordinators are going to move heaven and earth to make sure that you're hearing on a daily basis. So we feel very old-fashioned in our approach. We think that we're going backwards in time, and quite frankly, this wasn't our idea. Over the last 34 years, our patients and families have actually taught us what they need, what they want, and our job is to listen and to give that to them. So I hope this chart is helpful. There are several other sources that you can get hearing treatment or hearing transaction from. And I want you to think about something. If you or someone that you love has a hearing loss, I want you to think, just maybe even now, ponder, what is it you want to see happen for them? I just want to go buy a hearing aid. I don't care. I just want it to be louder. Great. You're going to shop over to the left. If you're a person who wants to have the strongest body, the strongest health, the strongest brain for life, you're going to want to shop over to the right. So I hope that clears up. This is going to be a short presentation, and we're going to flip over to the next slide. And now is a chance, if any of you would like to ask questions, go right ahead. You can unmute, ask the question, or you can post it up in the chat, and I'm sure Carla will figure out a way to cue me. We had a little technical difficulties a while ago, and so Carla is in the background running the slide deck. And I do want to encourage you to copy that number down, the 877-226-1186. and also the email address hosborn@sjhi.net, or you can visit us at stjohnshearing.com as ways to reach out and ask more questions if you want. I know there's going to be multiplication of viewing later on. We post this content on our website as well as provide it for patients and families to view later. So capture that while you can. Can you make appointments through the website? You can chat through our website, and Hazel, whose email address is posted here, will guide you through. She'll answer questions that you have initially, and we'll make sure that we take care of you. If we may do a little intervention and questionnaire that we may find out that there may be reasons we want to actually guide you to another provider, because in the end, we'd love to have all of you coming to see us, of course, but we also want to do what's best for you. Heather's got a question. Can people travel out of state to come see you guys? Absolutely. Absolutely. We will encourage that. Most of our patients are local, but we have a lot of seasonal patients. So here's how we handle that. Heather, those folks who come, maybe they're here 6 months and 6 months, or 3 months and 9 months, either way, we'll take them through the rehabilitation process. And then if they have a need that we can't resolve through technology, we can tap right into the hearing devices virtually for adjustments and modifications. But if there's something we need to do physically and they can't come to us right away, we actually find a provider in the area. We call the provider ahead of time, and we pave the way for our patient to go in and get what needs to be resolved without having to shop, because we feel 100% responsible for their hearing health. So what areas are you located in? We're located from St. Pete, Florida to Spring Hill. The majority, we're close to the coast, and we serve the 45 retirement communities that we spend probably 90% of our time in are from the Sunshine Skyway in St. Petersburg up to Spring Hill, Florida, Pinellas, Pasco, and Hernando counties. We do have visitors from Hillsborough, from Tampa, who will come over. Patients from a little east of our core market area. But what I would encourage you, if you have any questions about being too far, then go to our website or call the number or send an email, and Hazel will help guide you. And I would also go as far to say that if we're too far for you, if it's not convenient, and you just want to call and have us help you in some way, maybe find a provider where you live, we're happy to do that too. We're a little prejudiced. We think we're the best at what we do, but we also want to see you get what's best for you. So do you offer in-home visits? Absolutely. Positively. Our practice really is the core of our practice, trained by our patients, actually, is surround in-home visits in retirement community as well as private homes. Our patients seem to totally enjoy that, and they're so comfortable in their home environment. Our whole office fits in a case, and we actually bring it to you. So, all right. What I'm going to do, we're going to wrap up. I want to encourage you to reach out to Hazel. Thanks so much, you guys, for hanging out with us. And if you want more information, you can go to our website, look at the other webinars and podcasts that we have listed there. If we can't answer your questions there, please reach out in the chat or email Hazel. She'll start a conversation with you and help guide you to where you need to go. All right, we want to thank you guys for coming, and bless you. Have a great day, and I hope there's something that we can do to help you. Bye-bye.